Hello everyone, my name is Vida Njoku. Psychopathology Discussion 1. Question number 1. Define psychopathology versus normal mental functioning. Psychopathology is defined as the study of mental disorders, which is any significant behavioral or psychological syndrome that impairs an individual's daily functioning in society. Question number 2. What is the first step in helping someone who comes to you with mental health concerns? The first step in helping someone who comes to me with a mental health concern is to identify the problem. Number 3. What are the key criteria to determine the presence of a mental disorder? There are 4 criteria to determine the presence of a mental disorder. Number 1, the person is suffering or acting in a ways against her personal well-being. Number 2, the person's behavior creates discomfort in others and make them feel threatened or distressed. Number 3, the person's action or appearance is extremely unconventional, such as acting or talking irrationally, behaves unpredictably from situation to situation. Number 4, the frequencies the person exhibits the behaviors that matches the above criteria. Question number 4, what purposes does making a diagnosis serve? Diagnosis serves the following purposes. A. Knowing the type of disorder helps to plan appropriate treatment. B. Court may use the diagnosis to determine if a person is competent to stand trial or manage an estate. C. Helps researchers to study different aspects of psychopathology and evaluate treatment results. D. Diagnosis also enable insurance and health plans to pay for treatment. Question number 5. Are there disadvantages to labeling or giving a diagnosis? There are disadvantages to labeling or giving diagnosis. One such disadvantage is that it could result in dehumanizing the individual. Question number 6. There are some disorders that are diagnosed in various ethnicities rather than less severe alternatives, e.g. depression versus schizophrenia, intellectual disability versus ADHD. Explain how you as a social worker diagnosing could become aware of culture in the diagnostic process so that you can overcome biases. One way I, as a social worker doing the diagnosis, could become aware of culture in the diagnostic process so that I can overcome biases is to follow the NASW Code of Ethics and become competent in cultural diversity. Thank you.